It can take up to 1 hour for an ambulance to travel from Paphos to outlying neighbourhoods. In an emergency, time is critical, and this is leading to the establishment of medical facilities in suburban areas. One such centre is the Medical Emergency Response Clinic in KAMARES, which recently opened its doors to the public. The brainchild of the KAMARES Homeowners Village Association, the centre has been 2 years in the making and is a model for other communities. Tala resident Maureen Pollard, one of the driving forces behind the centre, explains why.
There has been emergencies where people have not had the immediate attention that they need. The ambulance couldn't find the place, so it's taken an hour to get there. So basically, that's exactly what happened. We decided to have our own clinic or medical centre.
The centre is non-commercial, but in order to balance the books, needs a minimum of 800 people to sign up for the service. The clinic is run under the licence of the IASIS hospital, which is providing medical facilities and a dedicated ambulance service.
The ambulance that's here at the current time is on contract to the IASIS hospital, and it is on 24 hours a day, and it's based here throughout the morning up to about 2 o'clock. Then it goes on to standby for the rest of the 24-hour period, and it will cover this area and anything west of the town of Paphos. Take that for satellite for the navigation.
Finding patients within the web of Tala neighbourhoods has been a stumbling block for rapid emergency response until now, but satellite navigation is scheduled for December. Until then, another system is in place.
In the meantime, what we've done, we've actually got a map of the area with all the streets on, and we've got locator points, the Castlevania restaurant as an example, and I can direct people. Each individual's now got directions from their home from a locator point.
A £50 registration fee covers around-the-clock emergency medical assistance and a morning GP service. Mail shots in Greek and English have informed people living in and around Tala about the service. What has the response been like?
It's been very, very busy. First thing this morning, we've had over 20 patients coming through the doors to register. Everyone seems very happy with the idea of the 24-hour response, but plus the GP surgery as well.
Ahead of an emerging trend, what would the KAMARES Village Homeowners Association say to another neighbourhood which is planning to establish a local clinic?
I think the first thing is you've got to be prepared for a long, hard slog, because it doesn't come easy. Then you have to identify the number of people in an area, the sort of markets you can approach, how many people you're going to attract. You then need to identify premises, which can be very expensive if you're not in the right place and have the right support from a developer. And then you have to identify a hospital that's going to support you and provide through their medical licence the licence to operate the premises.
As the strain on the public health service increases, other neighbourhoods will no doubt be watching the development of the clinic model at KAMARES.